Welcome to Ultrasound Shorts with Dr. Shopwe. This is a concise educational resource aimed at delivering to you essential concepts and skills in ultrasonography that are tailored to support informed decision making and effective patient care. In this video, we will be considering two main appearances of ultrasound images within the echogenicity spectrum: hyperechoic and hypoechoic. We have described echogenicity as the ability to reflect or transmit ultrasound waves. It determines how bright or how dark the ultrasound image will appear. And one thing we need to remember about echogenicity is that it is usually described in context with surrounding tissues or specific reference tissues. We can illustrate the appearances of the ultrasound images within the echogenicity spectrum using the diagram displayed in this frame. The rectangle above represents the tissue of reference, while the squares below represent the four main appearances within the echogenicity spectrum that will be described in context with the tissue of reference. Firstly, objects in an ultrasound image can appear anechoic or completely black. Here, no echoes are received from this surface or from the object by the transducer at all. Secondly, the area can appear hypoechoic, where it shows a darker shade of gray compared to the surrounding tissue or tissue of reference. Thirdly, the area or structure can appear isoechoic, where it demonstrates the same echogenicity with the surrounding tissue or tissue of reference. And lastly, the tissue or area can appear hyperechoic, where it has either a brighter tint of gray compared to the tissue of reference, or it is completely white. Likewise, in this frame, we see different appearances within the echogenicity spectrum in context with surrounding tissue, as we would see on an ultrasound image. On the far left, we have an isoechoic area, which has pretty much the same level of grayness as the surrounding tissue. This is followed by a hypoechoic area, which has a darker shade of gray than the surrounding tissue. This is followed by a hyperechoic area, which has a brighter tint of gray compared to the surrounding tissue, in fact, almost appearing white. And lastly is an anechoic area, which appears completely black as a result of no echoes received at all. Hyperechoic. This describes an object that is brighter than the surrounding tissue or designated point of reference. Other words that can be used in its place are hyperreflective, echogenic, echodense. An informal and non-standardized word that can also be used in its place is echo-rich. Avoid using the word hyper-echogenic. Objects that appear hyperechoic reflect sound towards the probe significantly, allowing only minimal penetration or absorption or attenuation. Examples of objects or structures that will appear hyperechoic on An ultrasound image include bones, stones, calcifications, intrauterine contraceptive device, hemangiomas, and vascular calcifications. This is a more extensive list showing examples of hyperechoic structures on the ultrasound image, ranging from anatomical structures to pathological structures and foreign bodies. Hypoechoic. This describes an object that is darker than the surrounding tissue or designated point of reference. Note the word darker, not completely black. Other words that can be used in place of the word hypoechoic include hyporeflective, echolucent, echodull, or echopore. Objects that appear hypoechoic reflect lesser sound waves and absorb or transmit a significant amount across the thickness of the material. So we have more penetration and less reflection. Examples of common hypoechoic structures seen on the ultrasound include renal medullary pyramids, fibroadenomas within the breast tissue, uterine fibroids, thyroid nodules, endometriomas within the ovarian echoes, and ovarian hemorrhagic cysts. Seen in this frame is an extensive but not exhaustive list of hypoechoic structures that will be visualized on the ultrasound image. On the left are anatomical structures, and on the right are pathological conditions which will appear hypoechoic on the ultrasound. Note that hyperechoic and hypoechoic can be used for the same structure in different contexts. These terms depend on the subject of reference in certain instances. A structure may appear hyperechoic to a reference point, but hypoechoic to another reference point within the same image. For example, the liver appears hyperechoic to the renal parenchyma in this image. However, the liver appears hypoechoic when compared to the renal sinus within this same image. Stay tuned for more videos on the other appearances of images within the echogenicity spectrum.